If I were diagnosed with glaucoma, one question I would definitely ask my doctor is, am I a candidate for laser? Hi, I'm Mohammed Almala. I practice in Central Florida, in Ocala, and in the Villages, Florida. Over the years, I've treated tens of thousands of patients with glaucoma. If you're new to this channel, I have an entire video on glaucoma, what it is, how we diagnose it, how we treat it, and I'll post the link to that video here. But briefly, glaucoma is an optic neuropathy. That means it is a disease process that damages the optic nerve. When you have glaucoma, that optic nerve, the fibers in the optic nerve slowly die off over many, many years. There are 1.2 million fibers that go through that optic nerve, and when you have glaucoma, they slowly die off. So how do we treat glaucoma? We treat glaucoma primarily by lowering the pressure inside the eye. We refer to that as the intraocular pressure, or IOP. When you have glaucoma, the treatment is to lower the IOP. Why? Well, we know that if we lower the pressure inside the eye, the rate at which the optic nerve dies or atrophies is slowed down. We hope to lower the intraocular pressure or pressure inside the eye sufficiently enough to where the disease progresses so slowly that it does not really affect the patient. In general, if glaucoma is diagnosed early and treated appropriately, the prognosis for vision is good. The majority of patients who have glaucoma retain their vision for the rest of their lifetime. So how do we go about lowering intraocular pressure? There's three main ways that we do that. Number one is drops, medications. Number two is laser, or selective laser trabeculoplasty. Number three is through surgical intervention. Now, typically, we reserve surgical intervention to patients where both laser and drops have failed. So if you've had laser and you've tried all the different medications and the pressure is still uncontrolled, at that point in time, we can consider doing incisional surgery for glaucoma. So with all these treatment options, why is it that if I had glaucoma, I would ask my doctor if laser is an option? Dating back to the early 2000s, multiple studies have shown that SLT, or selective laser trabeculoplasty for glaucoma, is just as effective as using drops. More recently, a large study out of the United Kingdom showed that if patients had either laser or drops as initial therapy, and we compared how they did, the patients who had laser at the end of 6 years had a better quality of life than the patients who started out using eye drops. Also, the patients who started out with laser or SLT as first-line therapy before drops, those patients were less likely to need more invasive glaucoma surgery during those first 6 years of follow-up after the study. So we know now that laser lowers pressure just as effectively as drops, but if patients have laser as first-line therapy, they have a better quality of life, and they're less likely to need more invasive glaucoma surgery. So for those reasons, if I had glaucoma, I would want to have laser therapy as a first-line treatment rather than starting on drops. But what about the dangers or side effects of having laser? Isn't it easier just to use a drop? Now, I have to admit, at the outset, using just an eye drop once a day or once at night seems like an easier option, but using eye drops is not as straightforward as it seems. Many patients struggle to put in eye drops correctly. Also, eye drops, you have to remember to put them in every night, and many patients, including doctors, struggle with remembering to use their medications regularly. Also, eye drops can have side effects or cause irritation around the eyes. Some eye drops can change the appearance of the eyes. Well, what about the laser? For SLT, or selective laser trabeculoplasty, the laser procedure itself takes about 1 to 2 minutes to do per eye. In general, the eye can feel a little bit irritated the rest of the day, but I tell my patients that by the next day, the eye should really feel back to normal. While any procedure can have risks, I consider SLT, or selective laser trabeculoplasty, to be one of the most benign procedures that we do. The risk of having a problem with SLT or a complication really is quite low. In general, we see a response from the laser usually over the course of 6 to 8 weeks. I will usually do laser and see my patients back 6 to 8 weeks later to check their pressure and see how they were doing. It is important to ask your doctor if you're a candidate for the laser, because not everyone is a candidate. There are certain types of glaucoma where laser may not be the best option. Now, if you're watching this far into the video, then you're someone who's really seeking information and someone who probably pays a lot of attention to detail. So let me give you a little bit more information about the laser. People often ask, how does the laser actually work? The answer to that is we really don't know the exact mechanism by which the laser works. The laser does not poke holes in the eye. It does not poke holes in the tissue that drains fluid from the eye. We apply a laser directly to the trabecular meshwork, and that's the tissue that drains the fluid from the eye. I tell patients that the laser irritates that tissue, forces it to function better, and the cells and the function to drain the fluid from the eye over the course of about 6 to 8 weeks start to remodel, and they function better. The drain of the eye works better. And if we're able to improve the rate at which fluid leaves the eye, then overall there's going to be less fluctuations in the pressure, and the overall intraocular pressure, or IOP, will be lower. If you still have some questions about glaucoma or about SLT, please feel free to type those questions in the comments section. I do appreciate your attention, and I hope you found this video useful. Thank you.